OCD is a condition I've worked with for years, and the thing that keeps me going is that people do get better from OCD. Hi, my name's Dr. Amita Jassi. I'm consultant clinical psychologist in the National Specialist Service for Obsessive Compulsive Disorder, OCD, Body Dysmorphic Disorder, BDD and related disorders. So OCD stands for Obsessive Compulsive Disorder. So people with OCD experience intrusive, horrible, repetitive thoughts, doubts, images, urges, kind of a range of things that just pop into their head and make them feel really anxious and uncomfortable. And often they think, because they've had that thought, something bad's going to happen. Not always, but often the case. And that leads them to do compulsions, which could be any range of things. It could be physical things like hand washing or checking. And it can also be mental rituals, so things that people do in their heads, like counting to 10 or sort of trying to put a positive image in their head instead of a negative one. And also lots of people avoid things because of these thoughts and also get other people involved. So they may get parents to give them reassurance and so forth. And these obsessions and compulsions, so the intrusive thoughts, images and doubts and the things that they have to do about them, cause interference and distress. So they get in the way of the things that they should be doing or the things that other people their age are doing. So that's OCD. So OCD used to be considered an anxiety disorder. So we categorise kind of disorders, in groups to try and understand them. And whilst it's not officially categorised as an anxiety disorder now, it's in a OCD and related disorders kind of chapter with other things such as body dysmorphic disorder, sort of trichotillomania and all of those kind of conditions. Anxiety is still a component of OCD. So when people get intrusive obsessions and thoughts and images, that makes them feel anxious, and that's often what then drives them to do a compulsion to get rid of that distressing feeling. So whilst officially it's not an anxiety disorder anymore, anxiety does play a real central feature to kind of what fuels the fire. The difference between intrusive thoughts and OCD is that intrusive thoughts that we all get sort of pop in and out of our minds. So, I'm having a few now that I'm talking to you, but I'm thinking about sort of what I'm having for dinner. And that it's not causing me any distress. It's not making me feel uncomfortable, and it's not then making me feel like I have to do something. So with OCD, it causes distress. It makes people uncomfortable, and they also think, it's often the unwanted ones that it will kind of latch onto, the scary ones, and then kind of make people feel anxious and then make them feel they have to do something to make sure that bad thing doesn't happen or to kind of undo the thoughts. So for most of us, we all get intrusive thoughts. They pop in and out, they don't really bother us, they don't really make us feel anything, and it's sort of, like trains that go through the tunnel, they just come in and out. But with OCD, it kind of gets stuck, makes people feel uncomfortable, and they feel they have to do something to get rid of the thoughts. OCD is such a vast condition, and that's sometimes why it may make it difficult for some people to realise that they've got OCD, because it can latch on to kind of religious thoughts, sexual thoughts, contamination thoughts, worries that somebody's going to break into your house. So, it's not with OCD that you kind of have, there are common ones, but it can be any range. And the way that you would know it's OCD is that if you're troubled by these thoughts that keep popping into your head and they're making you feel uncomfortable, and that then you have to do something as a result. So you're seeking reassurance, you're having to check something, you're having to do something in your head to make sure that bad thing doesn't happen. And if that's causing interference, if it's getting in the way of things that you want to be doing, like making you late to work, making you late to go to school, or causing issues in your relationship because you're constantly seeking reassurance and it's causing stress, those are the signs. So the content of the thoughts and the behaviours you're doing is not necessarily what makes the diagnosis of OCD. It's more having those intrusive thoughts and worries and having to do something and it causing stress and interference. That's the hallmark of OCD. We don't know the cause of OCD, regardless of whether it came about when you were a young child or whether it's come about when you become a new mum, for example. The treatment's the same. So the recommended treatments are cognitive behaviour therapy with a real emphasis on exposure, so facing your fears and realising that nothing bad happens, and anxiety sort of is there, but it comes down. And you could do CBT with or without medication, and people do get better. And it's the thing that keeps me going, is that you see people through the journey, some really severe young people we see in our service, and they come through and they get better. And then it's like with anything, a bit like when you have cancer and you've had treatment, you recovered, you just have to look out for the signs and symptoms, even when you're in remission, if there's a stressful thing coming up, just knowing what to look out for can keep that recovery going and jumping on it very quickly using what you've learned in therapy. In terms of how to support somebody with OCD, it really varies. So if it's somebody who hasn't had treatment yet or doesn't know they've got OCD, haven't accessed treatment, I think the biggest support people can provide is supporting their loved one or friend or whoever it is to access support. So, just sharing with them that you're a bit concerned, you've noticed, these obsessions and compulsions, you probably see more of the compulsions and the distress and interference, and supporting them to go to their GP to access support, which is going to a mental health service. If somebody is in treatment and they are asking, the OCD kind of really pulls the person supporting. So we know with OCD, parents have to get really involved, or they often ask for reassurance, or they're asked to get sort of the soaps and things for hand washing, or they support them to avoid things that they don't want to be doing. It's really important that parents try and link in the treatment and be guided by therapists of when to withdraw that support, because ultimately when somebody is doing something for OCD, like giving reassurance, that's another compulsion. It's very much like a hand wash, it's like a check. It's just another way for OCD to get get rid of that thought. But we wouldn't recommend somebody just stop doing that. So the person who's supporting the person with OCD, not to just wake up one day and say, right, I'm not giving reassurance, or I'm not going to provide the products that you need, but actually working carefully with kind of where the person's at in treatment and coming up with an agreed way of, okay, when will you be ready for me to reduce that accommodation, reduce that behaviour, and then sort of weaning them off it gently, but getting that person on board with that plan. We know sort of conditions like OCD, BDD and other anxiety disorders, it's all a spectrum. So we all have kind of appearance worries, we all have intrusive thoughts, and we might have habits, and we all experience anxiety. It's evolutionary, it's all kind of, the way we're made up. And for some of us, it doesn't get in the way of our lives. It's just something that, we get from time to time, we need it, and actually we function, okay, and it's not interfering. But for a group of people, so like 1 or 2% of people will get OCD, which has an anxiety component, same with body dysmorphic disorder. We put labels on some of those anxiety difficulties. And the reason we put labels, it's a bit of a shorthand to say that actually the anxiety around whether it's appearance or obsessions and compulsions or other things is getting in the way. It needs a bit of thinking about, it needs a bit of support. And whilst I know there's a lot out there in kind of mainstream media and so forth about kind of self-help and so forth, I think for some people that works, but I think when it gets to the point where it is distressing and it is diagnosable, we do recommend seeking support from mental health services. The reason being is that actually there's some really effective treatments out there, particularly cognitive behaviour therapy. And medications can also support with anxiety. So by getting a label, a shorthand, it gives a description of what's going on, and then is really a passport to accessing the support and recovery.